The pandemic has turned Rita Campo's life upside down. The fear of getting infected and losing her job have led to depression.
I was caught off guard by sadness and overwhelming tiredness. It was the result of having to work at home while taking care of my son. I have to make lunch and dinner every day and help him learn, while also helping my family. My number of household tasks was multiplied by 10.
Some anti-anxiety medication is out of stock in Portugal. Antidepressants are up by as much as 11%. There's a rise in alcohol and drug abuse, domestic violence, panic attacks, and suicide.
The COVID-19 pandemic has caused a mental health crisis in our region at a scale that we've never seen before.
Some doctors believe lockdowns and self-isolation are more damaging to society than the virus itself. Depression is taboo in some countries. That makes today's topic tricky for Nigerians. It's estimated 1 in 4 people struggle with mental illness in Africa's most populous nation. But there's little help. Here's Fanny Facha.
This is a hard place to catch a break. Millions of people here are struggling just to get by, and there are concerns the pandemic could push even more people into poverty and depression. 250, that's the number of psychiatrists available in Nigeria. 250 in a country of 200 million people where so many struggle with some sort of mental illness, but only very few have access to the help they need. You don't have to look far to find people struggling. Many are trying to protect their livelihoods and their mental health.
So how much is a crayfish? 2.5. That's the last. It can't be 2.5, madam. It's 1,200. I know the price.
Amara is self-employed. Her job, buying up beans or crayfish at a good price for resale. But with the pandemic, most of her clients' restaurants have shut down.
When I got the news from my customers that they're no more interested, at first it was like, are they serious? So I didn't take that as, I kept pushing. I sent them messages, I called. At the time, one of them responded that, Amara, let's see how it goes after COVID. How am I supposed to know when COVID will be over?
The uncertainty was too much, she says. It started to weigh her down. Back in April, she began to experience symptoms of depression.
At times I'll get up at night, I'll just be weeping at night. I'll just be thinking, I was thinking of a whole lot. How do I manage this? How do I take care of a lot of things surrounding me? How do I take care of my responsibility and all that?
Amara is one of millions suffering from panic attacks and anxiety, but there is a stigma associated with any form of mental illness in Nigeria.
Once you come out to talk about it, you'll be termed like, this lady has gone nuts. A lot of people see it as a big deal or a big sin.
Professional help is expensive. So far, Amara has only been able to afford one therapy session for $50, not enough to heal. Olayinka is one of the few psychiatrists remaining in Nigeria. Most of her colleagues have left, seeking better payment abroad. She decided to stay.
If we don't take mental health seriously, the population won't be as productive as we would expect. And of course, eventually the country will lose economically. We should put mental health on the front.
She wants the government to subsidize treatment.
If we don't prioritize mental health right now, we could have more cases of suicide, more issues, more domestic violence, more infanticides, more issues going on because people won't seek for help, but they will take it out on someone else.
With many Nigerians only beginning to feel the economic and mental impact of the COVID pandemic, the situation remains highly volatile.
Mental health is a talking point in Germany, a well-off country with a solid welfare system. Still, calls to corona crisis hotlines have spiked, just as in many other countries. In some places, the surging demand for antidepressants has led to shortages. The Great Lockdown had already hit manufacturers' supply chains. And the number of Americans who Googled information about panic and anxiety attacks reached a 16-year high as the novel coronavirus initially spread across the US. Well, experts say you're not alone. You've no doubt seen the slogan, "Leave no one behind." A sense of community is a real positive that's emerged from this crisis. We're social creatures. Living in self-isolation just isn't easy. Kiodora has more.
In 2003, a previously unknown virus caused the severe acute respiratory syndrome known as SARS. More than 8,000 people were infected and thousands were quarantined. Rima Styra conducted research into the mental health of people during their SARS quarantine.
And what we found was that there was a high percentage of people who had both PTSD and depression from having been in quarantine during the SARS episode. So what we found when we talk about PTSD, what we know is that people feel upset, hopeless, depressed, angry, frustrated. They feel there's a lack of control.
How can you basically explain the fact that people get this PTSD or experience depression?
So I think what happens is, post-traumatic stress symptoms, okay? So that's what they're starting to experience, is the fact that it's a traumatic event. And for people, when they were sort of thinking about the fact that they might develop SARS, or in this particular case, coronavirus, we were thinking about, am I going to make it? When am I going to feel the symptoms? Oh, I have a bit of a cough. Oh, I have a little bit harder to breathe. Is this coming on?
Although the current coronavirus pandemic is also throwing up such fears, there are differences now too, and some of these could even have a positive effect on people's mental health.
Now there's more of a sense of community. So what we see now is there's so many people in isolation that people don't feel they're the only ones. There's a lot more communication as well now. We have technologies. The other thing that's happened this time, which is very different from SARS, is that there's a lot of psychological support.
What are the things that people can do if they find themselves now in isolation?
Keep in touch with family and friends by using technology. They will provide you a tremendous amount of support. The other thing is setting out a routine. And routine helps in calming one's fears and anxieties.
Even though the world might seem grim at the moment, we should remember that there are still things we can do for ourselves and for others. Not everything is beyond our control.
Time to hand you over to our science correspondent, Derek Williams. He's been looking into the questions you've been sending us on YouTube.
Does plasma therapy work? And if so, when should it be administered?
This is another of those questions that needs regular updates since our knowledge in the area continues to evolve. Just a reminder, convalescent plasma is isolated from the blood of patients who've recovered from the disease, and it contains antibodies that help keep someone who's had it once from catching it again. Antibody-rich plasma can also be given to others as a medication. The method has been used to treat patients in a range of epidemics for over a century now, but it's proven surprisingly difficult to determine just how effective it is as a therapy for people who have contracted COVID-19. There's a couple of different reasons why, not least that it's hard to carry out double-blind studies involving placebos with people who were in the middle of trying to fight off a potentially lethal disease. Although plasma therapy has been given to many COVID patients in dire circumstances when doctors have run out of options, there's still no really convincing randomized control trials showing that the convalescent plasma really does help. Despite that, earlier this week, the Food and Drug Administration in the U.S. gave it what's called an emergency use authorization, which is quite a controversial move since a lot of scientists believe we just don't have enough evidence yet to justify it. And they say that political factors must be playing a role in the decision. There is some preliminary evidence that convalescent plasma therapy might be helping some people who receive high doses of it quite early after diagnosis. But there's still a lot of work left to be done before we reach what we would call substantial proof.
Most of us are getting used to all the new hygiene rules like masks, but for those requiring a little extra protection, how about this space helmet? It's designed by Colombian startup QL Concepts, and while the helmet may look a little out of this world, it has an important purpose, protecting frontline workers like nurses and doctors. The company sold 120 of the 3D printed headgear to customers in Colombia, El Salvador, and the United States. And if you still haven't mastered the art of mask wearing, check out how good the Japanese are with these handheld masks. Diners in Kyoto have been giving them a test run, holding the masks in their free hand to cover their mouths when not taking a bite. The idea comes from Kyoto Saga University of Arts. The prototypes are made of paper or non-woven fabric with handles attached. Students will use the test run to further refine the masks.